All the flu that is flu fit through print and some that is not. Virus, RNA enveloped, viral family Orthomyxoviridae, size 80 to 200 nanometer or their type ABC, surface antigen H, hemagglutinin and neuraminidase. Seasonal influenza. Seasonal influenza. Influenza, the flu, is contagious respiratory illness caused by influenza virus. It can cause mild to severe illness and at times can lead to death. The best way to prevent seasonal flu is by getting a seasonal flu vaccination each year. Each year in the US, on average, 5% to 20% of the population get the flu. On average, more than 2 lakh people are hospitalized from flu related complications, and about 30,000 people die from flu related causes. Some people, such as older people, young children, and people with certain health conditions, are at high risk for serious flu complications. Influenza A. Influenza A. The influenza A virus subtype that have been confirmed in human ordered by the number of no human pandemic that are H1N1 caused Spanish flu and 2009 H1N1 outbreak, H2N2 caused Asian flu, H3N2 caused Hong Kong flu, H5N1 is bird flu endemic in avian, H7N7 has unusual zoonotic potential, H1N2 is currently endemic in human and pig, H9N2, H7N2, H7N3, H10N7 avian. The influenza A virus subtype are labeled according to an H number for hemagglutinin and an N number for neuraminidase. Influenza B. Influenza B. Influenza B viruses are only known to infect human and cell, giving them influenza. This limited host range is apparently responsible for the lack of influenza virus B caused influenza pandemic in contrast with those caused by the morphological similar influenza virus A, as both mutate both by both genetic drift and resortment. Further dimensioning the impact of the virus in man, influenza B virus enveloped slower than A virus and faster than C virus. Influenza virus B mutated as at a rate 2-3 times lower than type A. Influenza C. Influenza C virus are known to infect human and pig, giving them influenza. Flu due to type C species is rare compared to type A or B, but can be severe and can cause local epidemic. H5N1 avian or blood flu. Avian influenza is an infection caused by avian bird influenza flu virus. This influenza virus occurs naturally among birds. Wild birds worldwide carry the viruses in their intestine but usually do not get sick from them. However, avian influenza is very contagious among birds and can make some domesticated birds, including chicken, duck, and turkey, very sick and kill them. Avian influenza is transmissible to humans. This requires extremely close contact with infected birds, particularly feces. H7N1 and H9N2 also bird flu. AI has to form with HPAI, H5 and H7 LAPI. HAPI is a noticeable disease to the OIE. Antigenic drift. Type A viruses in animal or human, genetically labile, lack good machine for proofreading and repairing of error occurring during replication. Genetic composition of the virus change as it replicates, result in minor change and is called antigenic drift. Antigenic shift. Influenza A virus can also swap genetic material with other subtypes of influenza A, including those of different species. Antigenic shift. The individual or mixing vessel that enable the scrambling of influenza genetic material from two different species can be either human or pig. Antigenic shift result in a new subtype of influenza virus that is different to that of both parent. Antigenic shift has occurred at least 3 times in the past, each time resulting in highly lethal pandemic. HA or HPAI viruses. HA or HPAI virus possesses a single arginine at cleavage site. HA of LPAI virus cleaved in only limited number of organs and caused only mild infection. HA of HPAI viruses possess a series of basic AA at the cleavage site. HA of HPAI viruses cleavage in almost all organs by ubiquitous protease. A carbohydrate side chain near cleavage site affects H cleavage. Conversion of LPAI to HPAI involve CHO deletion and an array of basic AA position at cleavage site. Pathogenicity determinants. Pathogenicity determinants. Capacity to easily infect as a species. Humans have alpha 2 6 linked sialic acid receptor for HA, but have alpha 2 3 linked sialic acid receptor for HA. We have both alpha 2 6 and 2 3 linked receptor. Capacity to spread widely. No prior immunity in a population. Capacity to infect multiple tissue. Multiple basic amino acid at the HAO cleavage site of HA. Cleavage by multiple proteases, less pathogenic strain are cleavage only by proteases in respiratory tract. Role of pig in avian influenza. Role of pigs in avian influenza. Avian influenza virus (AI virus) recognize hot cell receptor have terminally located and acetylsalicylic linked galactose by an 2 to 3 linkage. Or HI viruses recognize host cell receptor having terminally located and acetylsalicylic linked to galactose by an 2 6 linkage. The pig tracheal epithelial cell contain receptors having both type of linkage 2 3 as well as 2 6 linkage. Pigs are thus highly susceptible to both human and avian viruses. Pigs co-infected with avian and human viruses act as mixing vessels in which resortment or gene swapping occurs. Gene swapping results in transfer of HI virus gene coding for the ligand of human tracheal receptor into the AI viral genome. Cycle of avian influenza virus in animal and human. Pandemic disease cycle. Natural avian influenza cycle. Edema of Bartlett's. HPAI congestion and petechial in the skin on the hook and shank. Effect on proventriculus. H1N1 swine flu. H1N1 swine flu. 2009 H1N1 referred to as swine flu early on in a new influenza virus causing illness in people. This new virus has first detected in people in the United States in April 2009. This virus is spread from person to person worldwide, probably in much the same way that regular seasonal influenza viruses spread. On June 11, 2009, the WHO signaled that a pandemic of 2009 H1N1 flu was underway. Survival of influenza virus, surface and effect of humidity and temperature, hard non-porous surface 24-48 hour, plastic stainless steel recoverable for 24 hour, transferable to hand up to 24 hour, cloth, paper and tissue recoverable for 8 to 12 hour, transfer to hand 15 minutes, viable on hand 5 minutes only at high viral titer, potential for indirect contamination transmission, humidity 30 to 40%, temperature 28 degrees Celsius. H1N1. The virus was originally referred to as swine flu because laboratory testing showed that many of the genes in the new virus were very similar to influenza virus that normally occur in pigs, swine in North America. But further study has shown that this new virus is very different from what normally circulate in North American pig. It has two genes from flu viruses that normally circulate in pig in Europe and Asia, and but avian gene and human gene. Scientists call this a quadruple resurgent virus. The making of pandemic. The makings of pandemic. The gene is segmented natural facilities genetic rearrangement which leads to genetic diversity in type A. Antigen drift minor antigen shift measure. The major antigenic variation underlie the deadly worldwide pandemic due to population lack of immunity to novel virus subtype. New concern regarding disease epidemiology surfaced in 1997. A direct disease transmission from animal to human caused fatalities in Hong Kong. In pandemic virus is transmissible human to human. Pandemic influenza. An influenza pandemic is an epidemic of an influenza virus that spread on a worldwide scale and infect a large proportion of the human population. The 1918 Spanish flu is the most serious pandemic in recent history, killing 50 million people. There have been about 3 influenza pandemics in each century for the last 300 years. The most recent one were the Asian flu in 1957 and the Hong Kong flu in 1968. Swine influenza H1N1. Swine influenza A H1N1. History in US. A swine flu outbreak in Fox Dix, New Jersey, USA occurs in 1976 that caused more than 200 cases with serious illness in several people and one death. More than 40 million people were vaccinated. However, the program was stopped short after over 500 cases of Guillain-Barré syndrome, a severe paralyzing nerve disease, were reported. In September 1998, a previous healthy 32-year-old pregnant woman in swine influenza A H1N1 March 2009 virus described as a new subtype of A H1N1 not previously detected in swine or human. CDC determined that this virus is contagious and is spreading from human to human. The virus contains gene segments from 4 different influenza types: North American swine, North American avian, North American human, and Eurasian swine. Sign and symptoms. Sign and symptoms. Symptoms of novel H1N1 flu in people are similar to those associated with seasonal flu. Fever, cough, sore throat, runny or stuffy nose, body itches, headache, chill, fatigue. In addition, vomiting and diarrhea have been reported. How does novel H1N1 influenza spread? The virus is thought to spread the same way seasonal flu spread, primarily through its respiratory droplet, coughing, sneezing, touching respiratory droplet on yourself, another person, or an object, then touching mucous membrane. Example: mouth, nose, eye, without washing hand. High risk condition. High risk condition because person with intellectual disabilities may not be able to communicate that they feel sick. Additional attention need to be devoted to recognize when they are ill. Neurodevelopment delay including Down syndrome, asthma or other problem of the lungs, any condition that affect respiratory function, diabetes, heart disease, chronic kidney disease, underlying metabolic disorder, immune suppression including HIV or AIDS, sickle cell disease, children taking long-term aspirin therapy for chronic disorder. Swine influenza A H1N1 guideline for general population, covering nose and mouth with a tissue when coughing or sneezing. Dispose the tissue in the trash after use. Hand washing with soap and water, especially after coughing or sneezing. Cleaning hand with alcohol-based hand cleaners. Avoiding close contact with sick people. Avoiding touching eye, nose or mouth with unwashed hand. If sick with influenza, staying home from work or school and limit contact with others to keep from infecting them. Swine influenza A H1N1. Swine influenza A H1N1 treatment. No vaccine available. Antiviral for the treatment and or prevention of infection. Oseltamivir, Tamiflu or Zanamivir, Relenza. Used for antiviral can make illness milder and recovery faster. They may also prevent serious flu complications. For treatment, antiviral drug work best if start soon after getting sick within 2 days of symptoms. Warning: do not give aspirin, acetylsalicylic acid, or aspirin contained product. Bismuth subsalicylate, pepto-bismol to children to teenagers up to 18-year-old who are confirmed or susceptible case of swine influenza H1N1 virus infection. This can cause a rare but serious illness called relay syndrome for relief of fever. Other antibiotic medication are recommended such as acetaminophen or non-steroidal anti-inflammatory drug. Swine influenza treatment: adult, children, oseltamivir, zanamivir. Swine flu AH1N1 other protective measure. Define quarantine versus isolation versus social distance. Isolation refer only the sequestration of symptomatic patient either in the home or hospital so that they will not infect others. Quarantine defined as the separation from circulation in the community of asymptomatic person that may have been exposed to infection. Social distancing has been used to refer to a range of non-quarantine measures that might serve to reduce contact between persons, such as closing of school or prohibiting large gatherings. Personnel engaged in aerosol generating activity. CDC interim recommendation. Personnel engaged in aerosol generating activity, example collection of clinical specimen, endotracheal intubation, nebulizer treatment, bronchoscopy, and resuscitation involve emergency intubation or cardiopulmonary resuscitation for suspected or confirmed swine influenza A. H1N1 cases should wear a fit disposal H95 respirator. Pandemic clarification of transmission pattern for this virus. Personnel providing direct patient care for suspect or confirmed swine influenza A H1N1 case should wear a fit test disposal and 5 respiratory when entering the patient room. Respirator use should be in the context of complete respiratory protection program in accordance with Occupational Safety and Health Administration OSHA regulation. Swine influenza A H1N1 other protective measure infection control of third person in healthcare setting. Patient with suspect or confirmed case status should be placed in a single patient room with the door kept closed. If available, an airborne infection isolation room with negative pressure air handling with 6 to 12 air changes per hour can be used. Air can be exhausted directly outside or be recirculated after filtration by a high efficiency particulate air filter. For suctioning bronchoscopy or intubation, use a procedure room with negative pressure air handling. The ill person should wear a surgical mask when outside of the patient room and should be encouraged to wash hands frequently and follow respiratory hygiene practices. Cup and other utensils used by the ill person should be washed with soap and water before use by other person. Routine clean and disinfection strategy used during influenza season can be applied to the environmental management of swine influenza. Swine influenza A infection control of ill person in healthcare setting. Standard droplet and contact precautions should be used for all patient or care activity and maintained for 7 days after illness onset or until symptoms have resolved. Maintain adherence to hand hygiene by washing with soap and water or using hand sanitizer immediately after removing glove and other equipment and after any contact with respiratory secretion. Personnel providing care to or collecting clinical specimen from suspected or confirmed case should wear disposable non-sterile glove and eye protection to prevent conjunctival exposure. Type of protective mask, surgical mask, easy available and commonly used for routine surgical and examination procedure. High filtration respiratory mask, special microstructure filter discs to flush out particles bigger than zero point 0.3 micron. These masks are further classified oil proof, oil resistant, not resistant to oil. The more a mask is resistant to oil, the better is. The masks have number beside them that indicate their filtration efficacy. For example, a an 95 mask has 95% efficacy in filtering out particles greater than 0.3 micron under normal rate of respiration. The next generation of masks use nanotechnology which are capable of blocking particles as small as 0.027 micron. Swine influenza A biosafety guideline for laboratory worker. Appropriate disinfectant 7% ethanol, 5% Lysol, 10% bleach. All personnel should help self monitor for fever and any symptoms. Symptoms of swine influenza infection include diarrhea, headache, runny nose, and muscle ache. Any illness should be reported to your supervisor immediately. For personnel who had unprotected exposure or a known breach in personal protective equipment to clinical material or liver viruses from a confirmed case of swine influenza A, H1N1 antiviral chemoprophylaxis with Zanamivir or oseltamivir for 7 days after exposure can be considered. Influenza A H1N1 2009 monovalent vaccine injectable vaccine. Influenza A H1N1 2009 monovalent vaccine CSL Limited. Influenza A 2009 monovalent vaccine Novarest vaccine and diagnostic limited. For the injectable vaccine or shot, the virus is inactivated killed using the same process the manufacturer use of seasonal influenza vaccine. The vaccine administered via nasal spray contain a live attenuated virus. Timeline of emergence influenza virus in human. Lesson learned from first outbreak March 1918 in Europe, USA. August 1998 simultaneous explosive outbreak in France, Sierra Leone, USA. 20-40 million killed in less than 1 year. 20-35% of the world infected. Pandemic are unpredictable. A sudden sharp increase in the need for medical care will always occur. Capacity to cause several diseases in non-traditional group is a major determinant of pandemic impact. Epidemiology relay wave of infection, public health intervention delay but do not stop pandemic spread. Thank you.